Good day, everyone, and welcome to today's webinar, Leadership with Purpose, Advancing Safety in a Shifting Landscape. Our speaker today is Felicia Sadler of Relias. Felicia has been a registered nurse for over 35 years and has served in various nursing leadership roles. She is a certified professional in healthcare quality, a Lean Six Sigma Black Belt in healthcare, formally trained in Baldrige, and has served as an examiner for the Tennessee Center for Performance Excellence. She holds a Master of Jurisprudence in Health Law from Loyola Chicago School of Law and a Bachelor of Science in Nursing from South University. Felicia currently serves on the Ashram Education Development Committee and has served in the past as a chair for Ashram Educational Strategy Committee and Ashram's Educational Development Task Force. Felicia is an international speaker, having presented at numerous professional conferences. She has published several journal articles, including JNPD, JONA, and authored articles in publications such as Chief Healthcare Executive and Healthcare IT Consultant. At this time, all lines have been placed on mute to prevent any background noise. We will have a question and answer period at the end of the presentation. Please type your questions using the question pane at the right of your screen. They will be answered in the order they were received. Please identify the name of your organization. As a reminder, a copy of today's materials can be downloaded as a PowerPoint presentation in the handouts. This webinar is being recorded and will be available in the CIHQ YouTube partner page within a couple of business days. It's now my pleasure to turn the webinar over to our speaker, Felicia Sadler. Felicia, you have the floor.
Thank you so much, Michelle, and hello, everyone. Whether you're joining us during your lunch period, if you have a quick break to join us, or you're listening to this via a recording, we're really glad that you joined this time together. I want to bring quite a bit of value to in the way of this presentation, so I have a lot in our content. We have a lot to unpack, and without further ado, I'm going to go ahead and get us started. I would love for you to join me on LinkedIn. So I actually have a QR code here that you can scan to connect with me on LinkedIn and continue the conversations. Would love to connect with you all so that we can continue our conversations around Journey to Healthcare Excellence. I want to just kind of cover briefly cover the learning objectives for today's session, which you all have received that via when you registered. Today we're going to discuss some leadership strategies that really empower leaders to sustain safety and quality standards during times of rapid or uncertain change, organizational transformation. I think we're on steroids these days as it relates to transforming our organizations to meet not only the regulatory requirements, but also meeting the outcome-focused pay-for-performance requirements. So there's a lot to unpack that we'll talk about today from a leadership structures, processes perspective. We'll also discuss application of evidence-based approaches to really apply in situations where you're needing to address team resilience, enhancing, supporting communication among your teamwork or your teams, as well as looking at some real world leadership case studies and best practices on navigating challenges. I want to start us off and kick us off with a quote from Warren Bennis. Leadership is the capacity to translate vision into reality. And we're going to talk a little bit about transformational leadership. We hear that quite a bit, but what is it as it relates to really focusing on outcomes, leading teams effectively, and really having them catch the vision that we hope they would catch in really transforming an organization and impacting patient safety and patient care. Some of the top executive priorities were identified in the NSI 2025 report, executive report. And specifically, when we think about one of the top components, quality of care and patient safety, this was identified as a top executive priority at 91.7%. I want to mention that number 2, 3, and 4, patient satisfaction, patient experience, employee retention, recruiting high quality professionals. These all feed up into this #1 priority. I'm convinced and definitely of the mindset that when we provide high quality care, when we execute on patient safety and put that as a top focus, all these other components that are in 2, 3, and 4, all of those are correlated, and there's study and evidence that support this. We know HCAHPS definitely supports patient safety, patient quality. That was the original intent and really why we capture those metrics. When we think about bringing in high quality talent, certainly that impacts patient safety and the care of those that are in our care. And then ensuring that you're recruiting those high quality professionals that have an unencumbered license, that are able to demonstrate excellence. Those are the individuals that we hope will be attracted to our organizations. So when we think about navigating the landscape, well, we think about, navigation out on the water as we get to the end of our summertime, but hopefully you're still able to enjoy time out if you have the privilege of living close to water. When we think about getting out there and navigating, certainly there are rough waters that can occur. There are hurricanes. We're entering hurricane season. If you're, where it's super cold, you may have be able to encounter some icebergs, for example, or winds. When you're out there, the winds can shift. And so really navigating through those rough waters at times can be challenging. So how do you sustain the ship and keep it on course when everything seems to be, there seems to be a shifting landscape? Certainly we wish the waters were always calm, but in healthcare, they won't always be that way. I've been in healthcare long enough to know there's going to be turbulent times, there's going to be times of change. It does seem that it's happening at a more rapid pace than what it has been historically. But we're in for the long haul, we're in for the challenge. We as seasoned healthcare leaders definitely have been there before, and we know that we can sustain and navigate through those times as long as we have the resilience in our workforce, the resilience in our organizations, the structures and processes to navigate. And that really takes us into, when we think about the Baldrige criteria, you're going to see throughout this presentation a lot of tried and true, tested over time models that organizations have fared quite well when they've hardwired best practices, hardwired the fundamentals around quality, the fundamentals around healthcare excellence into their organization. They're able to sustain and navigate through those changing times. So when we think about having leadership committed to healthcare excellence, when we think about ensuring that there's a strategic approach, we've got our mission, vision, values, core values all in place. We have our internal and external customers well identified. We have outcome metrics that are appropriate to our mission, vision, values, desired outcomes that we're measuring appropriately. And then we have a lean process, a lean, seamless, streamlined workflow, as well as certainly the operations, all feed into the desired results, if you will. But we're also in healthcare on a performance improvement journey. So while we shoot for the stars and we shoot for excellence, perfection, high reliability, and so forth, there's always a journey, there's always a process for improvement and an opportunity for improvement. When we look at key attributes and identify key attributes of high-performing organizations, there's that shared sense of purpose. Now, you're going to see, if you're familiar with transformational leadership, relational leadership, there's a shared sense of purpose that's created through that process and through that leadership style. So creating that shared sense of purpose, interpreting and ensuring that you're able to translate that into vision, that vision into reality rather for your workforce, ensuring that there's an authenticity to the leadership components, ensuring that leaders who are walking the walk when it comes to healthcare quality, they mean what they say and they actually live it out. We live healthcare quality. There's a presence of an accountability system, so ensuring that there's some accountability metrics. We'll talk a little bit more about this when we talk about leading a culture of safety, but ensuring that you've got elements of accountability as it relates to quality, safety, and service, and then a clear focus on results, going back to and leaning back into that Baldrige criteria, ensuring that there's clarity and that there's transparency in those metrics. And then supporting a collaborative culture, ensuring that you're fostering the two-way feedback, two-way communication. We think about high reliability organizations. Certainly limiting hierarchies can be beneficial, and they certainly support that, so that everyone is able to have a shared voice, and everyone can feel heard as it relates to process improvement and healthcare excellence. No matter what your role is, and I know we have probably folks from all different walks and different roles of an organization, no matter the role, quality is at every level. We all can own quality. We can lead from wherever we are in the way of quality. When we think about frontline leaders managing patient safety for units, departments, no matter what unit department you're in, if you're in that middle tier role, there's a critical element, critical role for you all as it relates to engaging in quality and really advocating for the resources necessary for your teams, for the effectiveness of your teams as it relates to policy development, ensuring that you're measuring the right components as it feeds up into that mission, vision, and values of the organization, ensuring that you are employing and executing on the quality improvement initiatives, even taking it a step further and identifying where are the gaps and opportunities within your department, your unit, your service line, your facility, and then identifying where those gaps are and then addressing those through quality improvement initiatives, involving the team, involving a shared governance approach. And then also proactively, through a failure modes effects analysis, proactively identifying where are there opportunities, where are there opportunities for us to prevent adverse events, for example, of occurring. Ensuring that you're fostering that interprofessional collaboration, and certainly as leaders, making sure that the family, patients all have a voice in the process. I want to pause here for a poll question. So Michelle, do you want to launch that for the group? How would you rate the effectiveness of safety programs provided to staff in your organization? So these are your safety programs. How would you rate the effectiveness today? And we'll give you a moment. And Michelle, I'll let you determine when the sample size is where it should be.
All right, they're still coming in.
Great.
Okay, right now we're at 78% effective, 20% neutral, 80% effective. I think you get the gist of that. I'll go ahead and close the poll. Excellent.
So it looks like we have a nice sampling of a really good, when we think of 80-20, that's a great result where you feel like the effectiveness of your existing safety programs are where they should be. And those of you that are neutral may not know through the data or through the analysis process if they are. And so when we think about that 20, I always think 80-20 Pareto principle, but when we think about that 20%, there's opportunities to really tap into the data. So if you're not correlating the effectiveness of your safety programs, or you're not aware of those metrics, it would be good to, or prudent to dive into that, understand what are the safety training programs, how are they correlated to the desired outcomes, but also to our mission, vision, and values of the organization, ensuring that we're tapping into everything we need to tap into. When we think about effective, there's always room for improvement. So identifying where are there gaps, are we covering everything, and are we able to correlate the training program content and the training program output to any of the desired outcomes that we're looking for as far as determining effectiveness. So very good. Great job for you all. Thank you for participating. when we look at, when we think about and I mentioned and alluded to the iceberg previously. So you can see here what's underneath the water is much larger than what's above the water. And I'm sure you all have seen this in your own analogy or, with other situations. But when we think about the iceberg, we're navigating these waters. It's really what we can't see. What we do see, we can address, but what we can't see may be very deep beneath the water. And so this is really when we're looking at data, when we're looking at what's going on in the organization, it really is your frontline leaders who are closest to the process. We think about high reliability, we defer to those who are closest to the process. They're the ones that know and can inform and give us that real world feedback in real time. And so this is really where you want to dive deeper into and to ensure that you're not going to hit something that you can't see. You want to make sure there's transparency in the data, transparency in the process to ensure you're able to effectively navigate the waters. We think about nurse leaders being fundamental, and really any leader being fundamental to a safety culture. There has to be trust, there has to be accountability. We have to be sure we have a proper and accurate assessment of our current state, but also where are the gaps and what is our desired future state, identifying any unsafe conditions, certainly strengthening systems along the way of what we do know works well. A lot of times people want to navigate through change and want to change things, but we need to identify what's working well, refine that, continue to strengthen that, and continue to refine our processes, identifying future gaps. When we have leaders that are committed to a culture of safety, they acknowledge the high-risk nature of an organization's activities. So when we're committed to a culture of safety, we want to know where are the high risk, where are the risks that exist in our organization, and we want to make sure that we're consistently operating in a safe manner, even identifying near misses without fear of reprimand or punishment. Just culture has been around for quite some time. And I remember way back in the day when it really wasn't the cool term, if you will. It was just emerging, and there was a lot of fear, a lot of concern around just culture. Fear of being punished, fear of reprimands, for people to speak up. Well, we're now in a time where, and I won't say that it exists in all organizations. I will be realistic here that there's probably some out there where there's still a fear of that. But leaders who are committed to a culture of safety root that out. So when we think about the fear of reprimands or fear of punitive challenges, this is where leaders committed to that culture of safety ensure that they want to know the information, they want to know the root cause so that it doesn't happen again. I also will say that accountability is something that is important when we think about ensuring there is accountability. Yes, there should be accountability where it's necessary, individual accountability. However, the goal is to really understand what the issues were, what the challenges were, where the near misses were, where the adverse event through a root cause analysis process could be addressed. Those things we absolutely have to find out so that we can prevent those from happening or occurring in the future. That's the only way we get to high reliability and zero harm. And so on that note, as it relates to high reliability, preoccupation with failure, ensuring again through that failure modes effects analysis process, ensuring that we're getting to the root of where challenges are, deferring to our front line, understanding what they're telling us is absolutely critical. When we think about a commitment to resilience, we'll talk about organizational resilience momentarily in a future slide, but just that commitment to resilience, that's the way we're able to sustain. Once we get through these processes, we're able to sustain when we have a resilient workforce who is on board with us for that mission, vision, and values. There's a reluctance to simplify in a high reliability focused organization. We want to ensure that that things aren't passed over just and pardoned and just kind of put them to the side because they weren't relevant. Everything should be relevant so that we can uncover everything that was involved in a process and ensure that there's no gaps and no opportunities for improvement. And I wanted to mention, when we think about high reliability, we've got high risk. The airline industry, for example, they operate and function on high reliability. We always want to know the root cause. That's why you have all the investigations, but that's also why you have stringent processes. When we think about the OR, we have timeouts, we have a process to prepare a patient for surgery. We have that checklist that we follow. The reason for that is so that we can ensure that we're employing best practices that work, but also a process that we respect, and not necessarily play off and say it's not important, because we want to make sure that we have zero harm every single time. That is high reliability, zero harm, perfection, to the extent possible. Sensitivity to operations, again, ensuring that we're uncovering exactly what we need to, and I mentioned the deference to expertise. So effective leadership absolutely matters. When we think about ineffective leadership, this can lead to patient safety events and toxic cultures, cultures where, it's not, individuals, staff do not feel free to speak up. Fear of reporting, even if it's near misses, even if it's situations where the individual might have made an error, it did not result in patient harm, but they reported it anyway. We need to encourage those so we can learn from those. We can identify how that happened and hopefully prevent that from happening in the future. The lack of trust, certainly you must have trust within effective leadership. The lack of advocating for resources and staffing is critically important, as well as failure to prioritize safety. Those can all lead to patient harm. Mentioning the transformational leadership component, it's critical, and no matter what your role is, what level you are in an organization, transformational leadership and in engagement are critically important. Having leaders that are actually connecting to the front line, that are hearing from the front line, and we know the evidence is there, it's out there, and it's real. Over and over, it's been demonstrated that it contributes to positively to a patient safety culture, to better outcomes, and it was the strongest predictor for a safety culture. So ensuring that transformational leadership styles are dialed up, and there's plenty of information and data out there if you want to better understand that. I've got a few bullets here as it relates to the attributes of a transformational leader. You can almost think about this as a bit of a checklist, but it provides an overview. There's a clear set of goals. Transformational leaders lead by example. They clearly communicate their goals and their vision. They demonstrate a model of being of integrity and being fair. They encourage and inspire others. They provide and promote recognition. They stimulate people's passions. They're the type of leader that anyone wants to be like. They're the ones that folks remember well beyond leaving the organization, or they follow them to the organization that they're moving to. They know how to motivate people beyond self-interest. It's really getting them on board and engaged in quality, getting them excited about it, and getting them to be a part of that. They become part of the vision. Some examples of organizational initiatives that can occur from at the organizational level. So if you're at the organizational level, evidence-based team training, interdisciplinary rounding, which I'm sure many of you already do, as well as executive and senior leadership rounding. And rounding is not just the relational component, but also getting some feedback in real time. This is your time to ensure that you're listening to your frontline staff. This is their moment where they can actually speak and feel like that they're being heard, from the highest leader of the organization. But this also can occur even with mid-tier managers, ensuring that you're hearing the voice and but also acting on it. Examples of taking the input and acting on it, making it actionable. If there's a recommendation, sometimes you can get great recommendations from them as far as they'll provide you with the issue at hand, provide you with a recommendation, and then taking that on up and then putting that into action. There's no bigger compliment and recognition to an individual staff member to see their ideas put into action. Departmental and unit-based initiatives, safety huddles, quality improvement initiatives, debriefs, really to learn about near misses, errors and defects. This is a great time to really understand when there's a challenge, when there is a potential near miss or a near miss, what the individual staff members identified, and then taking that again, converting that into actionable outputs and initiatives, and empowering them to adopt innovative practices as well is a key component to really higher levels of engagement. When we think about sustainable leadership practices, when we're leading transformational changes or when we're leading an organization, being visible to staff, again, we mentioned that, sharing your vision, reaffirming the mission, vision, living it, discussing progress, but also keeping them in the know through the data and reporting components. So any dashboards that you have access to or privy to, sharing back that information to the team to show how effective that they are absolutely can elevate your team's level of engagement in the quality improvement journey. Celebrating successes both at the individual level as well as teams, and empowering your staff, encouraging them to participate on councils, on quality improvement initiatives. If you have a potential leader within your unit, department, service line that you'd like to take on a project that seems to be very interested and engaged, they would love to do that. It really is a beautiful thing to see them take that all the way to the end and be able to present back their outcomes as a result. Sometimes on our navigation pathway, when we're leading and navigating teams, it can be exhausting. Many times we have to stop and pause. So I've got a little self-care slide later on, but this is just an important reminder to pause, ensure and reevaluate that you're continued on your journey, that you're on the same track, you're exactly moving toward what you would like to move toward, whether it's through your vision, mission, values, outcomes, but ensure that you're on track. So evaluate, pause, reflect, and also encourage this with your team. This is really helpful when everyone's working very hard toward these goals. They're on board, but we want to make sure that they have time to reflect, celebrate, and evaluate. Resilience is an organization's ability to anticipate, prepare for, and recover from disasters, emergencies, and disruptions. During COVID, we saw a lot of organizations, and what I saw from on the national scale were organizations that were rooted in Baldrige, rooted in structures and foundational principles, were much more prepared for what happened during COVID versus those who may not have been on that journey, or maybe had not matured very far in that journey. There were distinct differences, and those who actually were founded, had actually already been on that road to high reliability, had already had structures, processes in place to mitigate disasters, and were well prepared, even beyond what COVID, which nobody could necessarily plan for that, but preparing for emergencies and disruptions, they were able to pivot quickly because they had those fundamentals in place. So agility absolutely plays into resilience, the ability to pivot when needed. We don't know what the next disaster is going to be or the next emergency is going to be, but we should always be preparing for and anticipating as much as we can. Also understanding that when we need to pivot and be more agile, we need to ensure that. I think COVID was if we've learned anything from that, I think that was one of the big pillars that healthcare and learning lessons learned that healthcare was able to move through. When we think about protecting and enhancing the workforce and customer engagement, supply network, all of these components should be considered as part of that resilience model as we think about preparing and mitigating future disruptions. So when we talk about leading quality and patient safety in changing times, there's a combination of 4 C's here. One is communication, collaboration, compassion, and continuous improvement. And we've alluded or touched on these throughout, but I wanted to pull them together as we near the end of our time, just as key themes, and to really understand them a little bit better. When we think about changing times, communication is critically important. We saw this during COVID, but also when we think about changing times, it really is where we are all the time, really, through its regulatory changes, through new models emerging from pay for performance. You know, there's always going to be some level of change, but ensuring that you have a safe, resilient team, you can lead with that. So if you build a resilient team, you can certainly employ and execute on communication. Communication is absolutely critical to not only patient safety, but also ensuring that you're effectively leading your teams with clear messaging as there are changes in protocols, as there are changes in policies and practices, and then also fostering an environment where team members feel comfortable, ensuring that you've got that two-way, it's not just a one-way, but a two-way communication path can absolutely ensure that you're engaging your teams. And again, that's on that journey to resilience. Compassion, ensuring that there's empathetic communication, ensuring that there is compassion, that staff feel valued, recognizing the psychological aspects, ensuring that there's access to resources to support your team as it relates to emotional health. Healthcare is not for the weak. Healthcare is for those that are passionate about their work. They're committed to providing high quality patient care, but sometimes that can get the best of us, no matter, you know, how strong we think we are. So ensuring that they have the appropriate resources, addressing burnout. This was a key issue during COVID, especially among new to the healthcare workforce. Those who had been in the workforce had seen the ups and downs, had seen many challenges, could navigate through a little better than those who were fairly new to the workforce. So, and new managers included. A lot of people got promoted through COVID because of the turnover that occurred. So you had new folks not necessarily well prepared to step into leadership roles, which can lead to burnout as well. Prioritizing patient-centered approaches that respect individual needs, of course. When we get to the last 2 of the 4 C's, collaboration, that culture of collaboration, encouraging interdisciplinary teamwork, involving everyone in the interprofessional team, bringing them all to the table for solutions, breaking down silos between departments. And I wanted to pause here because I meant to allude to this early on. You know, I remember when quality was a department down the hallway, and I'm going to date myself here, but down the hallway, and who was the director of quality? We didn't really know. Well, now quality is coming out, and everyone is part of the quality team, right? And so in a pay-for-performance world, in where we are today, we're all involved. Quality is cool. And we're all involved in it, and we're all on that journey. So engaging your team at every level when it comes to communication, collaboration is critically important. We're all on that continuous process improvement journey, and this when we talk about a culture of learning, it's really learning from what we're seeing in the data, learning from our structures and processes and where we can improve. We're always on that process improvement journey and using the data to help inform decision making. I wanted to mention AI. That's the elephant, the technical elephant in the room when we think about utilizing data. And I want to just put a plug in for humans. I'm convinced that humans should not be excluded from any data analysis process. Certainly AI is a great tool solution that can be used in many different capacities to help lean up processes, streamline data, streamline processes, but there must be a human that's involved in any AI outputs to ensure that that they're bringing the context that's necessary, because AI is not always privy to the context, and it's not always accurate. I've actually, in my own analysis of looking at it, I have found some oversights and some errors. So ensuring that you always include a human as part of that equation is critically important. When we think about considering the cost of quality, you know, I'm bringing in the lean perspective. We think about the cost of poor quality, which I'll talk about momentarily, but thinking about the fundamentals, and I'm always bringing in the fundamentals because, again, these are tried and true. These are fundamental to when we think about patient safety and quality. You know, the IOMs, the domains of quality, it must be safe, it must be patient-centered, it must be timely, it must be equitable, effective, and efficient. And these are all still true today, and they always will be. We may add some to them as patient populations or additional considerations come into play, but we want to ensure that we're always reminded of the fundamentals. These are embedded and hardwired in everything we do, from pay-for-performance models, value-based care, to delivery of safe outcomes, to streamline and standardizing our processes. These are fundamental to all we do, and certainly something that we want to continue to be mindful of. And again, these originated from what used to be called the IOM, now called the National Academy of Medicine. But again, I want to dedicate a slide to the great work that they did that we still see play out today. So when we think about cost of poor quality, you know, it's sometimes difficult to think about, okay, what happens with quality? You know, how do we measure quality? We know we see it in the outcomes, but what is it, and how can we put metrics to it? How can we put ROI to it? This is some of the burning questions that we hear quite often. How do you put an ROI to quality? You know it when it doesn't come out, doesn't play out. You know it when you have an adverse event. You know it when you have a hospital-acquired infection, or you have preventable harm that occurred. All of a sudden, quality comes front and center. When we think about cost of poor quality, I put some examples here. So when you think about nurse turnover, quality should always come to mind, because you've got to have a high quality workforce. You've got to have competent nurses, for example, competent healthcare workers in their respective roles to deliver high quality care. We think about an ill-prepared workforce. This is something that I'm concerned about. You know, we had a lot of compromises during COVID. A lot of academic programs went virtual. Did we compromise quality during that time because they did not get the opportunities to learn in a real world environment per se? So these are all examples, and I'm sure you all can think of many, many more. But when you think about quality, think about what happens when there's poor quality delivered. And on that flip side, that's where you can really get into some of the cost. They can be qualitative, they can be quantitative, they can be anecdotal, but there is cost. So how do we drive innovation in times of change? Certainly providing opportunities for innovation is absolutely critical. So as a transformational leader, ensuring that you're able to, or at least facilitate or provide opportunities for your teams to gather, to lead discussions, that keep a clear focus on the vision at hand, but also ensuring that you're bringing innovation and brainstorming on team-based PI projects, for example. And then ensure that you have ways to measure and track appropriately. Turning that data into a story, into actionable information. We're all about stories in today's time, but that's things that people can relate to. When you have stories within your organization, when you have quality improvement stories and you share those out, that involves others, because then they start engaging in the process and they start relating to those stories, and they start thinking about how they can translate that vision into their own unit, department, or service line. We talked a little bit about failure modes, effects analysis. So proactively plan, identify, mitigate risk, and engage your teams in the solution. Engage them in identifying the risk, identifying the causes. Take a lean approach. Have them, ask the 5 whys. Get to the root of the issue, the root of the challenge, and then also include them in the solution. And this is really deferring to that frontline expertise. I did promise a couple of case studies that are in the real world. So when we think about the University of Vermont Medical Center's MICU program, they actually identified and surveyed 33% and found 33% of their new nurses felt unsupported after or well beyond orientation. Now we see this a lot in the nursing workforce. When they've come off of onboarding, it's almost like, okay, now they're in the real world and they're independent and there's no support. And so this can lend to turnover in year 1 and even into year 2 quickly. So they identified this through their survey process, and they were able to develop a mentorship program. They also found that through this, they were able to improve job satisfaction, career advancement, as well as improving nurse retention. And this is something you could build on. So when we think about continuous process improvement, it doesn't stop here. You build from this. You can apply this to potentially to your interprofessional, your therapists, your allied health professionals, etc. Another organization was able to use data science to improve patient safety. They actually created a neural network model using information from 250,000 hospital stays to predict C. diff infections, and the data revealed that the acid-reducing meds that they were using actually increased the infection rates more than expected. So then they were able to flag high-risk patients, which provided the pharmacist the opportunity to advise the doctors on med use. They were able to reduce C. diff by half. Certainly this converted into an ROI metric. I would say that in increasing this and moving this beyond just the pharmacist to the MD, involving the nurses to be able to anticipate as well as far as the orders, the written orders, etc., to help navigate some of this. So these are lessons learned, and you can actually expand on these projects depending on what the outcome is and what the situations are. But these are great case studies. We talk about building a culture of safety and resilience, so bringing it together as we wrap up, that supportive work environment, providing those robust wellness programs. I've got a few additional, the flexible scheduling, psychological and physical safety, ensuring that they feel psychologically safe, going back to that making sure they feel safe to report is one example. To physical safety, we hear a lot about workplace violence, so ensuring you have strong protocols and structures in place to address and mitigate that, but also involving them in the solutions where appropriate. So I've got a lot of other recommendations that you all can certainly tap into as it relates to the content. John Maxwell is one of my favorite leaders out there. He has great quotes, but he quotes that leadership is not about titles, positions, or flow charts. It's about one life influencing another. And that really is purposeful leadership. It's transformational leadership, leading with purpose, to ensure that you're able to influence not only those close to you, but the entire organization. Being committed to a culture of safety, high reliability, that's something that every single committed healthcare worker is passionate about and would be more than happy to join on that journey. Ensuring that you're able to motivate your staff, again, to buy into your vision, and then aligning to common values and goals, uniting in a pursuit of excellence. And so as we reflect back, again, providing those opportunities to reflect, inspire your team with a passion for your vision and with the plan of making it happen. So they join on the boat that you're navigating as you navigate through the waters, allowing opportunities for individuals to reflect, but also you as a leader, opportunities for you to reflect on where your journey, your past, your present, and where you want to take your teams. So we're next. We're down to our questions, and I'm going to turn it back over to you, Michelle, to open us up.
Outstanding. Thank you, Felicia. As a reminder, you can type your question using the question pane. Please identify the name of your organization, as this gives our speaker insights to any special considerations that needs to be addressed. All right, our first question is from Kendall in Iowa. How do you get leadership involved to support quality initiatives?
That's a great question, and one that we frequently come across. Every organization's different, and some organizations, the culture is quite different in many organizations, and sometimes there is a challenge and it can be frustrating when it seems that your leadership is not as passionate and providing the resources where needed to really join in a safety culture and really leading quality. One consideration when it comes to meeting with your leaders around getting them engaged is really in the data, what you're seeing. I think they react to that when they see the actual data findings. So ensuring that you're gathering the relevant components and creating that story, but also creating a potential solution, or at least the next step, so that they can actually see it play out. So in other words, you want that story impact. You want to identify where are the challenges, where are the gaps, what are you seeing, what is your team seeing, and then what is the impact. And then showing that data to your leadership can be extremely powerful, and that can get them bought into what your vision is, but also they can create that larger vision so that they're driving that throughout the organization. That's a great question.
Outstanding, thank you. So from Sierra in Texas, how do you engage those who are resistant to change?
Yes. So on the flip side, you have leaders that, if you don't have leaders committed to a safety, from a safety perspective, that can be challenging. But on the flip side, when you're trying to lead those who are resistant, many times there are reasons for that. Understanding what those reasons are, where the resistance is coming from. Is it a lack of understanding to what's occurring? Is it a lack of resources? Do they feel like they're stretched beyond capacity to be able to participate? Alleviating some of those burdens once you get to the root cause can be very helpful, but also you can actually build champions. I've actually done this in my own experience, where those that started out resistant actually become the best champions, and they can actually champion that through the organization because they now are part of the journey. They've experienced this success, and they're able to share that success and lead it, and actually present it at conferences professionally as far as that journey. So you can take, through effective change management, you can take someone from a place of resistance to a place of championing for the organization. Great question.
Wonderful. And I've got one more in the queue from Brenda in Nevada. Where do you begin in developing a quality initiative?
Yeah, so that's another good question when we talk about where do we start. Many times you're pulled into different quality initiatives that you may not think that's really the prioritization, or that's the priority for your department. I would say that identifying through the data, through a gap analysis of current state, and no matter what your role is in the organization, where you are, identifying where are the gaps. So through an effective survey process, just like these organizations did, ensuring that you're gathering a relevant data, and then analyzing that data to find out where are the gaps, where are the opportunities, what's something that I can kind of own and take almost a leadership role in to drive change and drive improvements. So understanding what the gaps are, prioritizing what needs to be prioritized. If there's something that's more of a patient safety concern and you put that as number one, focus on that. But also identify where those quick wins, and this can go back to those who are leading change. Identify where the quick win opportunities are. Many times when you start getting those quick wins, they can see something more immediate, and then they're in for the longer the longer picture, the longer journey as well. So it's pretty exciting when you start. I always looked at it as a challenge. You know, you take on the challenge, and it's really fun to see folks really get on board and get excited about process improvement.
Oh, wonderful. Thank you. So there are no more questions in the queue. If you all have any additional regarding this topic, please feel free to contact Felicia and the Relias team using this QR code below. Have a great day, everyone. Thank you, Felicia.
Thank you all. Appreciate your time. Have a great day.